Anybody have any questions from week 1? Anybody have any questions overall? Why so quiet?
I have a question about we're supposed to be starting to work on our project, correct?
Which project?
The where we pick a topic and do a PowerPoint.
Oh, your vulnerable populations project that's due
Yes,
week
ma'am.
9? Yeah.
Yes.
Yeah.
Okay.
So
Is there
go ahead.
Is there a rubric
Yep.
available? Okay.
Yep. It's right in there with the module.
Okay.
Yep. Yeah. And so that project's due in week 9. You can go into week 9 and read the module. You are supposed to be, you are to pick a vulnerable population. Like I said last week, you had a discussion. Yes, I just want to verify we'll be doing the quiz. Yep, we're going to do the quiz today in class. Yep, you were going to do it together. We're going to do a lot of things together today in class. So that last week, your first week, you had a discussion question where you had to pick a vulnerable population and describe resources, gaps. So this week 9 big project is really an extension of that. You can use the vulnerable population you selected last week and expand on that. But it is a vulnerable population in your own zip code, in your own community, that you do a research PowerPoint on. Okay, this got confusing last term. I tried to make it more specific in the modules. There's 2 projects to do. One is your group project that's due, I believe, in week 7, where I assign you groups and you do an infectious disease paper. I assign you an infectious disease. Probably next week, I will split you up into the groups that I do for you guys, and then we'll go into the breakout rooms in your groups, and you can introduce yourselves, exchange phone numbers, decide how you want to tackle it. So I'll get that information all out to you this week, and then we'll meet in the groups in our lecture next week for a few minutes. So that's one project. Okay, that's a paper, week 7. That's a group paper on an infectious disease, and that's in your module. The other project is an individual project, and that is in week 9, and that's your vulnerable populations research paper, research PowerPoint. Okay, so your individual project is week 9, it's a PowerPoint. Your group project is week 7, and it's a paper that you do together as a group. And I'll send out the guidelines are already in your module, but I will send them out this week along with the groups. And then next week we'll get into our group for the first 10 minutes, get into your groups for the first 10 minutes of class, and you can meet everybody, exchange information, and see how you want to set it up. Does that help? So that's what we'll do for next week. For all of you that are coming in the last 5 minutes, please put your name and your campus in the chat. That's how I take attendance. Oops. Okay. Let's see, I've got still missing quite a bit of people, but we're going to get going. Okay, so today I'm going to cover your week 1 and week 2 notes. Okay. We'll do that. I have some areas in the book that I want to cover for your content. I am currently working on your exam 1 study guide. Okay, I'm working on that as we speak. I hope to have it to you in the next, no later than Sunday. Okay, no later than Sunday. I've got some work to do on it because I want to make sure it's a good reflection of what you're expected to know for the exam. Okay, and there's parts of it from last term that I need to update. Okay, so I am working on that. I sent you this week a copy of the master review schedule, right? Everybody got that. So you should, I did the whole term with all 3 professors so that you could plan ahead. I know your time is valuable and limited. If you can at all try and prioritize trying to attend a live review, that'd be great. If you can't, I understand. And I hope that you will watch the recordings. You'll have, I believe, 3 live reviews to go to. And then you'll have all 3 recordings. Okay. I'm going to try and save some time today no, I'm going to do that next week because the exam's not till week 4. Next week, we'll do kind of a mini review with the study guide in the last part of class. Okay, for those of you that can't attend, I just don't want you to miss out. Okay. What else? What else did I need to cover? Oh, I sent you your HESI prep. Okay, did everybody get the memo on the HESI prep? You have an original HESI prep. I'm going to share my screen. That's in your week 1 module that I want you to ignore. Where is it? Was it in here? Nope. Bear with me. Where it says, am I in the right right class? Yep. Okay. So where's our HESI prep? It was in there last week. Where is it?
Isn't it week 9, Professor Marvel?
Oh, that's where it is because that's when it's due. Oh, you guys are so smart. HESI prep right here. Okay, so download this document. This is not the document I want you to download. That's the original. Okay, that's from last term that carried over to this term. I've added several different topics into the new updated HESI prep that I feel is a better reflection of what's going to be on the HESI. And that's based on the last couple of terms of students taking the HESI. Okay, so let's just cover that now. So this is what the new one looks like. Okay. So ignore the one in week 9 and use the one I sent you. Okay, one of the issues that I ran into last term is that students were not completing this on a regular basis. You can, or you don't have to, or you could. What happened was when they got to week 9 and this was due, you had a blank document and it took hours and hours for students to get this completed. So the reason why I wanted to update it and get it to you quickly is that you could be working on filling in these boxes. All right. And I've even thought about, and I don't know how you guys feel about this, is taking some time at the end of each class and going through the HESI prep and identifying what we covered that week. And we can fill out those sections as we go so that you're not facing a blank document in week 8.
And where did you say we can find it at?
I sent it to you it's in your announcements this week.
You sent it already. Okay, because I didn't see.
Yep. Is there anybody seen it yet? Yeah, you should all have it.
Yes,
it's in your announcements. Yep. So
I mean,
that's
the announcement.
what
I I said, yes, I have seen it.
Yeah.
It's in the announcement.
So that would be a document I would print out now. Okay, I would print out now because that is intended to be a working document through the whole term. Okay, and maybe not this week, but maybe next week. We'll take some time and we'll start to review, okay, after 3 weeks, and maybe that's a good time to pull out your HESI prep, is when we've gone through the content before an exam. So at the end of week 3, we should review the HESI prep and highlight all the areas that we've covered and start to complete those boxes. Then at the end of week 6, we'll pull it out again before the second exam, and we'll fill in all those boxes that have been covered. So the goal is by the end of week 9, all your boxes should be filled in and you should just have to submit it. Does that make sense? So maybe instead of doing it every week, we'll do it every 3rd week, but you can be doing it in the meantime, right? So after today, we can go in and we can see, what have we covered? What have we covered so far? And it's not set up, weekly. We have to go find the topics. So I can tell you, in the first 3 weeks, we're pretty much covering this whole health promotion teaching section. Not all of it, but a lot of it. We'll do a whole section on home health, whether it's hospice, palliative care, respite care, infectious diseases. We'll do a section on. I can tell you this is week 3 right here, vulnerable populations. We'll be covering that next week. Okay, your migrant, your rural, your homeless, teen pregnancy, we'll be doing all that. Well, we cover LGBTQ this week, I believe. So anyway, all the topics that we cover throughout the term are within this document. So this would be a document I would encourage you to keep up with, unless you want to end up with a big assignment in week 8 or week 9. Okay, plus it's ongoing prep for the HESI. And this is about as accurate and as current as it gets as far as topics. I have no idea what the questions were on the HESI because I don't do that. We develop the exams during the term, but we don't develop the HESI. That's like NCLEX. That comes from a huge test bank of 1,000 questions. But I do know the topics that were covered because I followed along with you all in with the students last term in remediation. And these were the topics that came up. Okay, so this is a pretty accurate document of what is going to be covered on your HESI. Make sense? So I'm just from last term, I'm just trying to help you not run into the same problem as my groups last term, where they just didn't even pull it out until week 9. And then it was just really a hard one because you had to go back all the way to week 1. So anyway, that's my mantra on HESI prep. What else? So next week, let's plan on doing next week in our second hour of lecture. I want to do the quizzes. Every week we have a quiz. I want to do that. So this week we're going to do the quiz. We're going to do, we can look through our HESI prep and just check off what we've covered if we want. Next week we'll do it in more detail. And then we'll do our attestation. Okay. I think it's easier, and I really haven't tried this yet, to do the quiz during class, but I think the quiz during class will give us all an opportunity to talk through all these answers. Why is this one right? Why is this one not right? Okay. And so we can be doing that. I think we should do that together. I'm going to try it. So don't do your quizzes before class. Okay. Don't. I think some of the other professors actually lock their quizzes until like today, until they have class. I haven't done that. If for some reason you have done your quiz and you need to resubmit, I can't reopen the quiz, but I can, if you want to submit me the correct answers in a Word document, I can change it. But that's why we don't do the quizzes until after the lecture. Okay. So we'll do content from week 1 and 2 today. Then we'll do our quiz, and then we'll do our attestation, because the attestation has a couple of questions. And then next week, oh, I have a question. Are you guys, is anybody having any issues accessing NCLEX questions? Are you guys okay?
I'm okay.
Everybody?
Okay.
Okay, okay. And you're able to access it through your modules, no problem. Okay, perfect. Okay. What questions do you guys have? I'm hearing from a lot of people that are either going to miss class or be late for class. People are communicating with me. That's really good. I appreciate that. I had a few people ask for an extension. Could they turn in their discussion question initial response on Friday instead of Wednesday because of whatever was going on? So that's the kind of communication I need. Right? If I don't get any communication, I've already sent you an email that your discussion initial response unfortunately got a 0, but you can still do your peer responses and get partial credit for the assignment. Okay, so that's the kind of communication I'm talking about. It's been really, really good, really good. Yes.
I have a question.
Yep.
With our NCLEX questions, do it has to be like 50
Yeah.
all together?
Yeah.
Could we do like 10, or?
No, and it says that right in the module. We ask for you to do one batch of 50. And the reason why is because it covers all the topics you selected. If you select like 225s or 510s, it breaks everything up and you don't get the full effect of all the content selections. So that's why we do a batch of 50.
And our score has to be at 80?
You can turn whatever score you want. I gave my NCLEX, didn't I give my, I gave my NCLEX mantra last week, didn't I, during orientation? You remember what my NCLEX mantra was? What was it? Somebody tell me.
I don't know.
Remember, it was, if you send me a score below a 40, what am I going to do?
Oh, okay. You're going to send it back to us and tell us to try again?
If you
Okay.
want, I'm going to reopen
Yeah.
it. If you send me
Yeah.
below 40, I'm going to say, hey, I'm not sure how much you got out of this assignment with this low score. I want you to take advantage of the rationales with the wrong questions. And remember, you can take you can do the NCLEX as many times as you want, and you just submit your highest score. But if you submit below a 40, I'm going to just tell you, I'm going to reopen it for you. If you want to try for a higher score, just for learning purposes, and doing the rationales, it's open to you to redo if you want.
Okay.
Does that help?
Yes, ma'am.
Okay. Yeah, those NCLEX assignments are, they're really good. Those, you know, if you do poorly initially, it's almost better because you get all these rationales and learning, and then take it again and get a higher score, take it again and keep reading the rationales. And before you know it, you're going to be up to a 50. That's the whole point of the NCLEX assignments. Okay. It's not a one and done. If you have the time, do your one-off and then do it again. And then again. Okay. Okay. What else? Everybody have their name in the chat. Okay. Let's go cover some, let me share my screen. I am recording. Okay. So I have a couple of things open. I have week 1 notes and I have the books open. And there are a couple of, in week 1, there's a chapter 1 in which you're responsible for the content of the chapter. And that's in fundamentals. Okay. And then in week 2, since we're covering both today, you are responsible for chapters 11 and 12 in fundamentals. So those are the chapters I want to cover in the book and show you how to get the most out of those chapters. if it's not, if the assignment is not a full chapter and it's just reading pages, please just go to those pages and read those pages. But if it's a chapter, we need to go to that chapter and look at the objectives. And I'm going to show you how to do that. So for week 1, we just have one chapter. We have other reading, but we just have one chapter, chapter 1. And then with week 2, we have 2 chapters. We have chapters 11 and 12. Other than that, all the other reading is either small blocks of pages or it's in the module. And I think I went through this last week, but I'm going to show you again. In your modules, there's 3 different kinds of readings that you might be assigned book reading. Okay, so for example, in week 1, you had chapter 1 of fundamentals, and then you only had 1 page in the Med-Surg book, community care, page 123. Okay, but then there's another part where it says Canvas course, see Canvas course. So for example, in week 1, this is what it is when it means see Canvas course. There's 4 teaching sheets. Okay, so you have your week 1 reading, and here's your chapter 1. Here's your Med-Surg nursing, your 1 page. And then here's your 4 course, Canvas course instruction sheets or teaching sheets. Okay, so don't forget about those. Those are in your module. They're right in your module. You just click through and you'll get the 4 of them. First one is Introduction to Community Nursing. Okay, it falls right along your syllabus. Second one is Levels of Healthcare, and we'll go through that. Okay, so don't forget about when it says Canvas, see Canvas course, those are right in your module. Okay. So I want to show you how I think it's best to go through when you have a chapter in the book. Okay, so this is fundamentals. Okay, so here's chapter 1. This is chapter 1. Okay. So there's objectives of what we're looking at. Okay, so if you are responsible for a whole chapter, you are responsible for being able to articulate these objectives. Okay. So for example, okay, here's our objectives. Okay. I always try to go to the key terms. So when it says describe Florence Nightingale's influence on nursing training, go to your key terms. Okay, and see if you can find Florence Nightingale. She is not in here on the key terms. So we have to go into the chapter. Okay, and we have to find, here she is. We have to find what was her influence. Okay, does that make sense? So we have to go through these objectives. Okay, and I don't know how much preparation you guys have done. I don't know if you have read through chapter 1. I have no idea. But by the end of chapter 1, you should be able to give a simple answer to these objectives. Explain why nursing is both an art and a science. First, I'm going to look in the key terms to see if, like, for example, let's go to the objective that says evidence-based nursing. Just define, number 3, define evidence-based practice. Explain why it's important. Okay. Well, we have a key term that says evidence-based practice. Going to take us right there. Okay. It's right here. Evidence-based practice describes nursing care that uses the best research available. That's what evidence-based practice is. Does that make sense? So if you're assigned a whole chapter, you've got to go get the answers. You've got to go Got to go find these answers. You don't have to read the whole chapter from start to finish, but you need to be able to go in and find out, at least answer these questions. Does that make sense? The two chapters I want to focus on, and I know I'm skipping around, but they're chapters 11 and 12. Actually, nope, I'm not going to get out of sync here. I'm going to go back to our notes. Okay, so that's chapter 1. Okay, then we're going to cover our notes. Okay, the notes we've put together for you are an excellent summary of your readings. Okay, it doesn't take the place of your readings, but we'll put together a nice summary for you. Okay, one of the first things you have to understand about community nursing, and I talked a little bit about this last week, is your client can be any age group across the lifespan, right? Can be infants all the way up to the elderly, right? So you're caring for people throughout their entire lifespan. Okay, so that's one. Your client could be an individual in the community. It could be a family unit in the community. It could be a subset of the population. Let's say homeless, elderly, children, teen pregnancy. Okay, or it could be your entire community population. Okay, so your clients can be different at any given time, and they can be at any age group across the lifespan. And that's why this course is given at the end of your program, right? You guys are almost done, right? Because here, now we start to pull everything together. And a lot of this class is med-surg focused. All right, if you look at all of week 2, our whole part of this week is common childhood ailments. Okay, there's numerous questions on the exam with regards to the common childhood ailments to review in week 2, numerous. Okay, it's very med-surg focused. And you say, well, this is a community class. Why is it med-surg focused? Why is it pediatric focused? Why is it geriatric focused? Well, think about it. In the community, you have to bring all your tools together, right? You could be caring for a pediatric patient or an elderly patient or a wound care patient or whatever. Everything has to come together because in the community, you have to use all your tools. You pull your tools from geriatrics, from maternity, from peds, from fundamentals, assessment. That's why this class is at the end. Okay, so yes, this class is heavily med-surg focused. Okay, so the other thing we have to understand is what is the difference, and you will get asked this, what is the difference between community-oriented nursing and community-based nursing? Okay, simple. I look at the words oriented and based. Okay, that's how I remember it. If you're oriented, if you're focusing on community-oriented nursing, you're looking at the whole population. Okay, you're trying to figure out what are the health needs of the community, right? So you're focusing on wellness care versus illness care, right? And you're focusing on the whole population. So I look at it as you're orienting yourself to the community. Okay, you're looking at the big picture. You're focused on health promotion. Whereas if you're participating in community-based nursing, you're already based in the community. You're caring for the ill. Okay, you may be a school nurse, you may be a hospice nurse, you may be a home health nurse, maybe an occupational health nurse. It's focused on illness care instead of health promotion. Okay, so that's the big difference. Okay, so community-oriented nursing is also another word for public health, because what does public health do? We focus on looking at the whole population. Okay, most of our community work is done with primary and secondary preventions. Okay, when we're caring for people in the community. And we'll go through that in a minute. Primary is prevention, secondary is screening, and tertiary is treatment. And we'll go through that here in a minute. It's in this box. Okay. And I'm skipping through these notes. So it doesn't, what I'm skipping through doesn't mean you don't need to read. Okay. So what is primary? All right. This is important. We're going to go through you already know what I know you've already heard the terms primary, secondary, and tertiary, correct? Now we have to translate that into the community setting. Okay, so a primary prevention in the hospital may look very different than a primary prevention in the community. Okay, so I do P primary is for P prevention. S secondary is due for S screening. T tertiary is due for T treatment. That's how I remember them. Okay, so for primary, we're trying to prevent something before it ever occurs. Okay, whether that's an illness, whether that's an accident, you know, by teaching adolescent kids when they get the license about motor vehicle safety, whether it's teaching adolescent kids about, you know, younger kids about helmets when they ride bikes, whether it's teaching, informing or educating parents how important immunizations are for the prevention of childhood illnesses. That's all primary. Okay, so secondary, I look at secondary as early identification and early intervention. Okay, early identification, early intervention, early detection, right? So if we can early detect something, we can maybe prevent complications or prevent it from going any further. So we're kind of attempting to reverse the course. All right, so secondary, so maybe mammograms, blood pressure checks, maybe in the schools where screening for kids who may be at risk for obesity. Okay, and working with them to educate them on, you know, the risks, the long-term risks of obesity. And then tertiary is treatment. So we're trying to manage what they have. Okay, management of disease to reduce symptoms and improve the quality of life. Okay, so let's say somebody has heart disease or they've had a stroke. We're trying to help them manage that condition, that disease, and maybe help them reduce symptoms, give them a better quality of life. Okay, maybe we're working with them with weight loss if they're obese. Maybe we're working on coping mechanisms with clients that have mental illness. They already have something. And the one thing that I want to mention about these three interventions is a lot of students get caught up on education as part of primary. Okay, education is actually involved in all three of these. So if you get a question on an exam about what's primary prevention or whatever, and it says education, education could be at all three levels. For example, when we're trying to teach to prevent, our education is geared towards that, education towards prevention. All right. Our education in the secondary level would be, we have identified you to be at risk for obesity. So we're going to educate you on the long-term risks of obesity or smoking. Okay. Then education at tertiary is they already have something. So we're educating them on how to manage it. All right, so don't get caught up with education just being at the primary level. It's not. Okay. Okay. Issues with uninsured and underinsured. Okay, what do we think the issues are? If you are uninsured or underinsured, what kinds of problems might that create? Like, for example, well, let me just let you know that uninsured, underinsured, these are people that are less likely to going to seek primary care, right?
Yes.
They just are. So what happens? What's the result of that? when they finally come in to be seen,
Their
where they,
situation is probably worse because they don't have the proper insurance to get.
Yep.
that's exactly right, right? So they receive less preventative care. They're diagnosed at the much more advanced stages of diseases, right? And then we have two levels of healthcare in this country, and it's private and public. And there's a huge difference between the two of them, right? What's the Affordable Care Act, right? That was access, right? Access for uninsured individuals. And number three, you need to know what the Affordable Care Act did, okay? It improved access to health care for people that couldn't afford private insurance. Okay, so that's important to know. Okay, here's what's impacting our healthcare in the US. Okay, well, we know that uninsured individuals access to quality care. We know that people are living longer, right? Through technology, medication advances, technology advances. Okay, there's a lot of things impacting the healthcare system. Okay, what is Healthy People 2030? What is their primary goal? We need to know that right here. To improve the health and well-being over the next decade. It's as simple as that. Okay, so if you're asked a question about Healthy People 2030 and what their goal is, okay, yes, this is their overall goal: improve health and well-being over the next decade. Simple. How are they going to try and do that? Here's your bullets right here. Okay. The other thing that's an important term that we need to know is social determinants of health. That's the fancy way of saying what determines the health of an individual, what determines the health of a family, what determines the health of a community, what determines from a social standpoint. Okay, so social environmental issues. Okay, so social determinants of health are conditions in the environment where people live, learn, work, play, worship that affect the functioning of their community, of their family, of them. Okay, and so every individual, every family, every community has these 5 social determinants of health. And they all look different. They all look different within for an individual, for family, for a community, but they all have these 5 determining factors. Okay, there may be some communities or some families that do have economic stability, and there may be others that don't. Same with educational access, healthcare access, the neighborhood. Okay, resources in the community. So these things, these 5 determinants, do give a picture of how you are functioning as an individual, how your family's functioning, how your community's functioning. Okay. And here's some things that impact these determinants of social determinants. Do people have safe housing, transportation? Do they live in safe neighborhoods? And do they live in a community where racism, discrimination, and violence are present? Other opportunities for education, job opportunities. What's the employment rate, unemployment rate? Do people have access to nutritious foods and physical activity opportunities, their parks or their rec centers? Is it a community that lives with polluted air and water? Are there language barriers, cultural barriers? So lots of things. Okay. So we know that social determinants of health contribute to a wide health of disparities and equities. Okay, people who don't have access to grocery stores with healthy foods are less likely to have good nutrition. Right? And poor nutrition increases their risk for health conditions like heart disease, diabetes, obesity, maybe lowers life expectancy. Okay. Vulnerable populations. Let's talk about them for a minute. What are vulnerable populations? Let's name some. What are some vulnerable populations? Homeless?
Kids.
Hmm?
Kids,
Kids?
Elderly.
Elderly,
Mhm.
childbearing teenagers,
Perfect.
Prisoners.
Prisoners.
Absolutely. Absolutely. What about the non-English speaking
Refugees.
Hmm?
Refugees.
Refugees, immigrants,
Migrant
foster
farm
care,
workers.
migrant farm workers? Yeah. These are all vulnerable populations. Okay. So think about where you live. Everybody probably has the same core of the vulnerable populations, but also every community is different. Okay. There may be communities that have a higher teenage suicide rate than other communities. There may be communities that have much higher rates of homelessness than other communities, but every community has vulnerable populations. Okay. Children. Children are typically referred to as the most vulnerable population. Okay. Okay. They're not able to advocate for themselves, right? They can't protect themselves. They rely on adults, caregivers, guardians to guide their way. Okay. The World Health Organization identifies children as being particularly vulnerable to poor health outcomes, right? Especially with natural disasters, right? So your children are vulnerable. Here's your vulnerable populations we address. Children. Why are the elderly vulnerable? There's a section on that. Okay, some other vulnerable populations, the chronically ill, the non-English speakers. Okay. So a couple of definitions. Vulnerability. What is vulnerability? It's we're all vulnerable to some extent, right? Okay, it's our susceptibility to actual or potential stressors that may lead to an adverse effect, right? And which would lead to an adverse health outcome. Okay, internal factors, external factors, genetic risks could lead us to vulnerability. Exposure to lead-based paint, right? And then here's a bunch of statistics, a bunch of bullets about vulnerability that I want you to take a look at. Like I said, I don't know how much you've prepared. I don't know if you've read through these notes, so I'm not going to go through everything line by line because I have a lot I want to cover today. But the few things that I want you to be, I need you to understand what resilience is. Okay. Right. So what is resilience? It's the ability to resist succumbing to your health risks. Does that make sense? The higher your resiliency, the more likely you're going to reduce your risk. Does that make sense? That's important to know. Okay, you're going to get asked about resiliency. So you need to know that what does high resiliency lead to? Less risk. Okay. The other thing we need to talk about that's I think at the end of your study guide is motivation. You need to understand how people are motivated. So here's a couple of bullets on resiliency. Okay, so you need to read through those. We also need to read through and you need to understand what disenfranchisement is, right? When you feel disenfranchised, how do you feel? You feel like you're on the outside, forgotten, unimportant. Okay, so feeling like you're separated from your community or your family. Okay. We talked about social determinants of health. Okay, this is important. Okay, we're going to talk about this throughout the entire class. Okay, if you're asked about what is the I'm trying to put it in a different way. What is the biggest factor that determines the health outcome of a person, a family, a community? Okay, the answer is the financial stability of that individual, of that family, of that community. Okay, so if you are financially stable, you have resources you can access. If you are not and you live in poverty, poverty is the primary cause of vulnerability. That is just a fact. So if you were asked about on the exam, what is the primary cause of vulnerability? There's only one answer because it's asking for a primary cause, and that is poverty. Okay. The other vulnerable populations that we skipped is veterans. Remember that veterans are considered, for purposes of this class, a vulnerable population. Okay. You can read through why that is. Okay. So those are your notes. I want to go into the into our four Canvas readings. Okay, so we've probably already covered quite a bit of this, but introduction to community nursing. Okay, this is what our class is all about, right? What are the duties of the community nurse? What's our roles and responsibility? What might we be doing? We might be a planner, we might be a health educator, a trainer, a counselor, community organizer, coordinator of services. Okay, these are all the different roles. We may be an actual direct caregiver, researcher, statistician. There's a lot of roles that community nurses play. Okay. I do want you to read this part here. How are community nurses responding to the COVID pandemic? You're going to get asked about that. Okay. So read that little section. Okay. If you're a community nurse, like I was a school nurse up until last year when I retired for 20 years, but I can tell you the last 2 years, I went from a school nurse to a COVID nurse. That's all I did for the last 2 years of my school nursing was COVID. Okay. So what was our job, or what is still our job as a community nurse with regards to the pandemic? Okay. We're now shifting our energy towards vaccine distribution, right? Making sure the highest risk clientele are prioritized. Okay. I can tell you that community health nursing has changed post-pandemic significantly. Community health nursing was, I wouldn't say not well known, but they have been thrust, public health nursing and community health nursing, which are essentially the same, have been thrust into the spotlight because the pandemic has been a public health issue, right? So I for sure think that the pandemic is definitely going to be changing our approach to community health, public health. I think our focus and it says it right here, is going to be going forward will be our emphasis on preparedness and preventative measures for the next pandemic. Okay. I think the COVID pandemic made us realize in a lot of places that our infrastructure wasn't adequate with equipment, with vaccines, with lots of things. Okay. And that's what our goal is in community nursing, is keeping communities safe. And here's a nice list of resources if you want to read about just the gist of community nursing. But remember, for us, public health nursing is about keeping communities healthy. Okay. And then here's our levels of prevention. Okay. Here's our primary, secondary, and tertiary. So this is a review. You can read through that. Okay. So that's something you can review. We've already covered that. Here's your summary on Healthy People 2020, 2030. Okay. We've already reviewed that. That's in your notes. That's why I said your notes are a good summary. And then your introduction, definitely read this page, your introduction to vulnerability. Okay. Again, it's a summary of your notes, but goes through why children, why the elderly, chronically ill. Okay. Okay. Then I want to go now into week 2. I want to be in the chapter 11 and chapter 12. Okay, this is an important chapter. This is covered pretty extensively on your exam. Okay, so chapter 11 and 12 are full chapters that you need to be aware of. Okay, and so we have to start with these. You have to start with your objectives and go through that exercise for these 2 chapters. Okay, so you are responsible for understanding and being able to articulate these objectives. Okay. Adolescence is a big area that we focus on. Okay. Actually, let's go through this, and I'm going to highlight the areas that you need to know. Okay. I need you to know this section right here, page 147. Okay, I don't need you to worry about theories of development. Okay, but we need to know what age groups we're talking about. Don't need to know about the theories. Okay. Okay, we need to know about infants. Okay. Actually, we do need to know about infants, but not the whole section. That's what we need to know. We need to know this box about the infants. Okay, page 150. All right. And then young children. That's our next section that we need to know about. Age group is 18 months to 6 years. Okay. Here's what we need to know about this group in this box, page 153. Okay, these health promotion of each of these groups. So we did where are we? Health promotion of infants. health promotion of young children. And then our next section is middle and older children. Okay. This box is important, 11.3, to know about emotional intelligence in this age group. You will get asked about emotional intelligence about this particular age group. Okay, so this is important to know with this group. Okay. And I'd also like for you to review this section, psychosocial development in this age group. Okay. And then the next group is adolescents that we need to know about. Okay, and I've highlighted a couple of sections in here I want you to read through. I definitely want you to read through the sexuality paragraph with regards to adolescents. I definitely want you to read through the cognitive and psychosocial development of the adolescent section. We're on page 159. Okay. And then this, since we're kind of responsible for the whole chapter, have a look at this key points at the end of these chapters. They're really good. They're key points or key summaries. Now, a lot of it's not going to apply to what I've asked you to review. This is a summary of the whole chapter, but there's certain bullets here that do apply to the information you need to be responsible for. Okay. And then our next chapter is chapter 12. Again, we're supposed to be looking at the whole chapter. So we only have 6 objectives here, right? List the 3 stages of adulthood. Let's not worry about this. Don't worry about that one. Let's see, how do I get that out of there? I want to get rid of these 2. Let's not worry about these. There we go. Let's not worry about 2 and 3. Okay, so take that off. Okay, so the 3 stages of adulthood. Oh, we do need to know this. We need to know what the functions of the family are. Okay, that's something you'll need to know. Okay, and this is of any family. Some may be more functioning than others. Other families may be dysfunctional and these aren't working. Okay, but this is a list of the generic functions of a family that we look at with each individual family, right? Are they able to provide for their family? Is it a safe environment? Is it a nurturing environment? Do they interact appropriately with others? Is education part of their functioning of the family? Do they have lots of kids? Do they have fun together? Do they support and help each other? Those are functions of the family that we determine, is this a healthy family? Is this an unhealthy family? But those are functions that we look at. Okay. I'd like for you to look at the section of health concerns of young adults. That is addressed on the exam. What are some health concerns of young adults? Risky behavior, stress-related illnesses, early diseases. Okay, those 3 areas. Okay. So they're looking at 3 different, what's our first objective? They're looking at 3 stages of adulthood. Okay, I just want you to be able to identify the 3 of them. Okay, the first one is young adults. Okay, page 166, and I just need you to identify what the 3 are. You don't need to go through and read the whole sections. Okay, I do want you to read this section though of the young adults, the risky behaviors, the health concerns of young adults. The 3, just those 3 right there: risky behavior, stress-related illness, early disease. Okay. And then the second is middle adulthood. Okay, page 170. Anytime you can get one of these boxes, these gray boxes that's within a section, have a look at it because it's a nice summary of what's covered in that section. Okay. And then what's our 3rd section? Sorry. Where's our 3rd section? Middle. Trying to find our last section. What's our last section here? Anybody read through this? Young adults.
I don't see nothing for older adults after middle adult.
Young adults, middle adults. It's got to be the elderly, but I don't. Just 3 stages of adulthood. Okay.
I feel like it's going into chapter 13, Professor Marvel.
Okay, and we don't have 13, so let's stop at those 2. Okay, let's stop at those 2. The other two topics that come up in week 2 are school nurse and lead exposure. Okay, so let's talk about the school nurse because there's no reading about the school nurse in the book or lead exposure. They're both right here. So what do we think a school nurse does? What does a school nurse do? Anybody have any interaction with your kids and what?
Working with kids and trying to prevent certain things from happening or fixing situations.
First aid.
Yeah.
Okay. I can tell you that school nursing has certainly evolved. I can tell you in the last 5-7 years in school nursing for me, I was training people how to do trach care, catheterizations, insulin injections, emergency seizure medications, because we do want all the kids in school, irregardless if they have disabilities or not. And so we have to make the environment safe for them to be in school. So, when I first started in school nursing 20 years ago, it was, simply, doing clinic visits and giving out Band-Aids and ice packs and maybe giving a medication here and there. And that was it. But now school nurses are doing lots and lots and lots of procedures and G-tube feedings, male and female cathing, ostomy care. So lots going on. We do know that school nurses help families in many, many ways. Not only do they provide care to their kids when they're in school, but they also provide lots of resources for parents who may have food insecurity or may need health insurance or may need referrals to doctors. So school nurses are really a good wealth of knowledge as far as resources. We know that chronic health conditions in schools are increasing dramatically. Okay. Asthma is one that comes to mind. Students can have, nurses help the parents work with these chronic conditions. Obviously, the goal is to reduce absenteeism and have these kids in school as much as possible. Okay. We, like I said, we also help them get health insurance. See what they qualify for Medicaid. Let's see. School nurses not only make a big difference for student health and academic achievement, they can also save money. Research shows that for every dollar spent on a school nurse, there's a savings of double that, right? And those savings come from preventing costly emergency room visits. I mean, we head off a lot of emergency room visits by trying to take care of the issues during the school day. Does that make sense? During the last 2 years, especially when schools were closed, we did lots of our care, both in a lot of it remotely. All of our meetings were remote, all of our IEP meetings with our special ed kids. So we were providing health services both in person and remote, right? And our roles and responsibilities of school nurses has increased significantly, especially from the role we played in dealing with public health crises like the pandemic. Okay. Most schools are open now, but the school nurses played a very important role in keeping, reopening the schools and trying to protect the health and safety of the kids. Okay. We also do lots of education and lots of health and wellness teaching in the schools to staff, to kids. Okay. So school nursing has evolved dramatically over the last 20 years. Lots of things being done in school nursing. And then lead exposure, really important with kids. All right, how do we prevent exposure, lead exposure to kids? Okay, where would we find lead? Where is lead?
In paint, some chipping paint, like kids like to peel paint off the walls.
Mm-hmm. Yep.
And some pipes for older homes may be built with lead pipes.
Mm-hmm. Mm-hmm. You're going to get asked about
Pencil
lead
lead,
poisoning. Oh, go ahead.
pencil leads,
What?
pencil lead.
Mm-hmm. What are some exposure risks? If kids are exposed to it, here's a list of four potential serious harm to kids: damage of the brain and nervous system, slow growth and development, learning and behavior problems, and possibly hearing and speech problems. Okay. You will get asked about lead exposure on your exam. So we need to know what are the risks. Okay. What are some common ways kids come in contact with lead? As we said, put objects containing lead, dust. Young children can be indirectly exposed to lead when they put objects containing lead, dust, such as toys, trinkets, or their fingers in their mouth as part of normal development. They are exposed through paint chips, which we said. Whether it's in the home, in daycares, in schools, paint that lands on the windowsills, the floor, or on their fingers. Okay, their exposure is more common from swallowing house dust or soil contaminated by lead paint. Okay, that's the most common source of lead exposure. Okay. Exposure to lead can seriously harm a child's health, including damage to the brain, nervous system, growth and development, learning behavior problems. We just talked about that, hearing and speech problems. Okay, lead paint or dust are not the only ways that lead exposure can occur in kids, right? Soil, dust from the soil, drinking water, traditional medicines and cosmetics, some consumer products. Okay. And there's a nice resource here from CDC about lead exposure, preventing children's exposure to lead. Okay, and there's a toolkit down here. I don't know if you work with kids that you need to be educated, but this is a great toolkit for lead exposure prevention. Okay. So let's go through and see what we haven't covered yet in our week 2 notes. We just talked about all the roles that nurses play. So again, this is a summary. Okay, so here's all the roles the nurses in the school nurse could play or wear, or, oh, sorry. Okay. This is a good section, prevention in the school. Primary prevention in the school, preventing a problem before it even occurs. So we're not just trying to prevent a disease or a condition, we're also trying to prevent injuries, okay? Especially with the kids. Seatbelt safety, helmet safety, playground safety, prevention of sports-related injuries, prevention of substance abuse behaviors. And then here's your reduced risk of disease. That's part of it, but there's also 2 other parts. We need to remember this with the kids. Prevention of injuries, prevention of abusive behaviors, and obviously reducing your risk to disease. Okay, and it goes through secondary. Here's some excellent examples of secondary. Okay. And then tertiary. So I would definitely have a read through. I mean, you're responsible for these notes. So I would, if you haven't read them yet, I would definitely read through these. Okay. Then there's the whole section on family development. Okay, what is a family? What are the functions of the family? We just talked about that. Traditional family, let's not worry. You don't need to worry about what's in green here, table 8.1. Okay, you don't need to worry about that. What are some family health risks? Okay, you're going to get asked about that on your exam. Okay, genetic issues, environmental issues, behavioral issues. Those are all risks that we could find within a family. Health risks across the lifespan. Okay, and then this is where you really need to focus. You need to read through this entire section of common childhood ailments. There's numerous questions on the exam about these particular common childhood ailments. Numerous. Okay. So I want you to read through those. Asthma, talk about asthma, and in your syllabus, it gives you the the pages to read. These notes are essentially a summary of those pages. Okay, so you've got asthma, you've got eczema, diabetes, conjunctivitis, scabies, lice, pediculosis, lice, ADHD, and iron deficiency anemia, scoliosis, and lead exposure. Okay, so they're although you need to be familiar with all of those. There's questions about each and every one of them on the exam. Okay. So those are your week 1 and 2 notes. Went through the 3 chapters, 1, 12, and 11 and 12. Please make sure you can answer those objectives in those chapters. Please review your notes. And definitely review the section of this week. It's in your maternity and peds book of all your childhood ailments. It gives you a couple of pages for each one. Go through and read that. Okay. So let's pull up our quiz. Was it helpful to go through all of that like we did?
Yes.
Okay, let's pull up our quiz. I'm going to share my screen. You can fill it out as we go along. You can take notes on it and fill it out after, but if we want to fill it out as we go along, that'd be great. Let me get it. Tell me when you're ready. We have 2 things to do. We have our quiz, and we have to do our attestation. Am I sharing my screen?
Yes,
Okay.
Yes, ma'am.
All right.
Ready.
So does everybody have it pulled up?
yes.
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 Okay. So I want this to be interactive. Okay. So based on what we talked about, what's the correct answer for number 1? Remember, community-based nursing, you're working in the community.
Evaluating the outcomes of community vaccination program.
That's community-oriented.
I thought it was providing diabetes diet education prior to hospital discharge.
I thought of the teen pregnancy prevention.
Nope.
Which
I
one?
would say it's,
Community-based nursing.
I say educate a child and a school teacher on the use of the inhaler
Yes. Why is
Okay.
that correct?
because it's going to be
it's within the community.
Yeah, that nurse is in the community working.
Correct.
you're going to be
That's a school nurse working in the community, teaching a kid and a teacher how to use an inhaler. Right? Developing a teen pregnancy prevention program is part of your community assessment, right? Where you're looking at the whole population. Do we need a teen pregnancy prevention program? Evaluating the outcomes of a community vaccination program, right? That's looking at the big picture of the community, right? Providing diabetes diet education prior to hospital discharge. That's looking at your community as a whole. The only one that's community-based is the school teacher, is working in the schools, right? So you guys understand that? Okay, so the correct answer is the second one, B. Okay, let's go to the next one. Okay, we went through this earlier. What is the simple purpose of Healthy People 2030?
A.
Okay. And why are the other ones not correct?
Healthy People 2020 or 2030 is all inclusive.
Exactly. Exactly. Good job, Kendall. Exactly. All the rest are honed in on a specific issue, and that's not what their overall goal is. Okay. The question is asking, what's the big campaign about? So A is the right answer. Number 3.
it's going to be B.
We talked about this.
It's C.
I would say C. I would say C.
3 is going to be Number 3 is gonna be they are less likely to develop preventable illness.
We're likely to do
They're more likely to be
illnesses.
diagnosed
I
with
So
think
it'll be
it's the
C.
Yeah,
advanced
it's gonna
disease
be,
because
It's
they don't
A.
have the
C.
insurance or the money
It's
to go see
C.
a doctor.
It's
so they
C.
don't
It's
see a
C.
doctor
It's C.
It's C.
until
Everybody
they
It's-
agree that it's C.
because if they uninsured, they're gonna get what, diagnosed late, right?
Yeah.
Yeah,
Because they don't have the coverage.
Yeah, it's
Yeah,
gonna be
right.
C.
because they are less likely to seek preventative wellness visits.
Mm-hmm.
They're more likely, okay, so let's do A. They are less likely, right, to attend preventative wellness visits. B,
Yes.
they are more likely to develop preventable diseases. And the last one, they are more likely to need government health resources, right? So C is the correct answer. They're much more likely to be diagnosed with advanced diseases. Okay. All right. Number 4. Select all that apply.
51-year-old war veteran,
Yep.
the 31-year-old with HIV,
Yep.
and
What about the pregnant person? Well, no.
the
Why
19-year-old.
is that not a right answer?
Because just because you're pregnant, don't mean you're gonna be.
It's not a teen, adolescent person.
Right, it's not an adolescent.
Bingo. Excellent. What about the 19-year-old substance abuser?
Yes.
Yes.
They vulnerable? What about the 23-year-old with an STD?
No.
No.
So B, C, D,
Yes.
or 2, 3, 4?
Mm-hmm.
Here's our resiliency question.
It's A.
The more resilient they are, the less. No, the less was.
Resilience
I can't
reduce.
say it, but I know what you're talking about.
You had it right the first time.
It's A.
Resiliency reduces your vulnerability to certain risks.
Right.
Right? The other 3 are not correct. Resiliency is learned. Resiliency is not dependent on genetic predisposition. And actually, with number 2, resiliency decreases the likelihood that you'll get sick. So the 2 things that we need to focus on, and you're going to get asked about on the exam, are resiliency and motivation. And on, where is my old study guide? I added, this will be in the new study guide. I added some information because it wasn't really covered.
Professor Marv, I got a question. I thought you said when you was talking earlier, resilience leads to a higher risk. You said it doesn't?
No, the higher resilience you have,
Oh, the higher resilience, the lower
yeah, the
risk.
better
Okay,
you're
sorry
going to
about
be
that.
able, the better you're going to be able to manage things, right?
Okay, I got it. Sorry about that.
Hey, no. I'm just, I'm trying to get something I want to, hang on. Oh, there it is. Let me read this to you. Okay, take notes here. It's going to be in your study guide, but take notes. I know we're going to stop here at question 5 because I want to talk about motivation. Okay, resiliency and motivation are going to be on the test. Okay, so how do you help people become more resilient? How do you motivate people to advocate for themselves for healthcare? All right, so here's a couple of important things to remember about motivation. Okay, for motivation, it's important to learn a couple of things. Number 1, how do people feel about, and I know I'm going off on a sidetrack here, but this is going to be covered, so I want to cover it. How do people feel about their health problem? Do they think the problem's serious? Do they think that the action on their part will make a difference? Okay, do they think that they can manage their barriers? To actually perform it, to whatever they need to do, whatever barrier, let's say it's a lack of transportation or a language barrier. Can we motivate them to sort out their barriers so that they will get the care they need? Okay. And then just listen to this. Motivation will most directly impact positivity by interventions that is relevant to them, that is meaningful to them, that is given by trusted sources. So that's why it's always so important when you're developing client relationships. What do you have to do first? In your relationships
Build
with your
rapport,
clients.
find out, ask questions, talk to the patient.
Okay, but before that, trust, right? They need to be able to trust you. You have to develop some sort of trust for you to be able to motivate them. In order to motivate them, they have to trust you. You have to have a good, solid relationship. Okay, that's always the most important thing in establishing relationships. Okay, so we need to have an understanding of motivation. Okay. All right, let's go to question 6. Question 6 is an ABC question. Got to think safety first here.
Is it gonna be the 9-year-old?
A,
It's gonna be B, complaining of coughing, unable
And
to.
unable to. See?
Why is B the right answer?
Because airway. You're not able
It's
to
like
cough.
they short of breath
well,
while
it
they
says
doing
he's
physical
complaining
exercise.
of a cough, so he can cough, which is good.
But he's unable to participate in his
With
exercise.
his dyspnea on exertion.
Right. So what is that a classic potential sign of?
Asthma.
Respiratory.
An asthma attack.
Asthma, respiratory distress.
Yeah, an asthma attack. All the other 3 kids have an issue. Okay. And that will get dealt with. But you're asked to prioritize. This is a priority question. Which students should the nurse care for first? So the one with the ABC issues. Okay. We didn't really discuss iron deficiency anemia specifically, but if you guys have reviewed your notes, which food should the nurse recommend for a child with iron deficiency anemia?
Eggs.
Why?
For the protein?
Everybody understand that? So if you get asked about this on the exam, the correct answer is eggs. Okay. Hey, question 8.
Advise the parents to obtain a full medical evaluation.
Why?
I was C.
What could this be a sign of?
Eczema.
Yeah.
Okay. What else?
It's another skin disease. I forgot what it's called.
Isn't it diabetes too?
Bingo. Good job, Tawada. Why? What is this called? Dark discoloration along the neck crease.
No, it ain't called.
And I can't even pronounce it. Anthosis? Remember that?
Oh, yeah, yeah, yeah.
Okay. So that is, and that is a potential symptom of diabetes. Right? So the correct answer is we want to advise the parents to obtain a full medical evaluation. Okay? Because that could be a precursor to diabetes. Number 9. Think of common childhood ailments here.
A.
A,
Advise increasing iron intake in the diet.
Well,
Evaluate.
how do you
Lead
how could you advise increasing iron intake in the diet if you weren't sure what it was into, right? Determining a family history of developmental delay doesn't really, don't need to do that.
No.
We need to evaluate the environment for potential lead exposure, right?
Yes.
Because we just learned that one of the potential
In your
outcomes
role.
of lead
It's
exposure
the
is
developmental delay.
developmental delay,
Mm.
right? Okay,
Oh, surely.
number 10.
Encourage students to reduce overall screen time.
Why is that correct? Why is that the correct answer?
to make a
Just
move
to make a
more.
move
Like
around.
being a couch potato.
Get active.
Get active. I mean, the recommendation is 30 to 60 minutes of activity daily. That's a recommendation. Okay. I mean, obviously, you're not going to advise for more snacking. They don't need an urgent medical evaluation at this point, and we don't want them drinking 100% fruit juices, right? So there's your 10 answers. So you can submit it now, that's fine. If you've already completed it and want to resubmit your answers, you're just going to have to send me the 10 answers in a Word document. This is not an assignment that I can reopen for you. But I'm fine if I don't even know how many people did it. Okay, next, pull up your attestation for week 2. Might as well do this now too. So we're getting 2 things done. Okay. Let's do your attestation. 4 questions. 1 and 4 are the same. So why don't you just go in and do 1 and 4 right now? They're the same. It's today's date and me. This is not the way I wanted this set up for this term, but it is what it is. We have to do it this way. But I figure if we do them together, we can get the right answers, get it submitted, and then you're done with it. But 1 and 4 will have the same answer. So please put those in there. Okay. Okay, number 2, define primary, secondary, tertiary. Who wants to start with primary? What's primary?
Preventing.
Yep. Primary is prevention. What's secondary?
Screening.
What's tertiary?
Treatment.
Treatment.
Oh. Okay, so that's your question 2. Let me know when you're ready for question 3. We have to give an example of each one. So I'll give you this scenario, you give me the
Excuse
example.
me,
Oh, yeah.
Professor.
Yep.
Which one was for the secondary?
Screening.
Okay, thank you.
Yeah. So let me give you a scenario and you tell me what primary is. I am a school nurse in a high school and I would like to teach about, I'm a school nurse in a high school. What do I want to teach the kids about that may prevent something down the road? What would be an example?
Since they're just now learning how to drive, seatbelt use and the importance.
Okay, so type that in there for primary. So we could be teaching about seatbelt safety to kids in high school. We could be teaching about substance abuse, safe sex,
Eating healthy.
eating healthy. It's all about prevention.
So basically, this would be like education. Well, I know it's education. for all.
Education for prevention. Right.
Okay.
Yeah. And then secondary, let's use the same scenario. We're in the high school. Secondary is screening. What do we maybe want to screen for in high school setting?
Oh, hearing and vision.
Mm-hmm.
Yep. Screening for hearing and vision. We could be screening for kids that might be at risk for obesity. Right? We could be screening for kids who might be at risk for depression or mental illness.
Mhm.
I don't know, maybe we could do a survey. Right? Remember, screening is all about early identification, early intervention. Right? We could be doing a screening on
STDs, because some high schools.
STDs. Yeah, perfect. Perfect. Yep. Okay, and then let's take tertiary, same group of kids. But now we have identified, we do have a 10% of the population is obese. We have had a couple of suicides. Okay, we have what else? Obesity, suicide. We have an increased report of depression to the counselors. Okay, so let's think tertiary. What are we going to be doing in the tertiary?
Coping mechanisms for students for depression, maybe a screening tool used by guidance counselors.
Perfect. Perfect.
And as far as obesity, you could do teach them how to manage their weight or lose weight, exercising.
Yeah, maybe start a walking program or something. Okay, they already have their obesity, they already have their mental health diagnosis or depression. And then let's say your school has had a couple of suicides in the last year. Maybe we're doing a screening tool on, maybe we're doing a in-service on suicide prevention, or because we've already had some events. So now we're going to discuss how do we manage that? Does that make sense?
What about support groups?
Support groups, absolutely. Support groups actually is a good one. Yep. So does that give you a good understanding of primary, secondary, tertiary? So we do have to have a good understanding of that. And the one thing we have to do is to be able to apply primary, secondary, tertiary to all these different topics we're covering. So like 1 week, it may be environmental health. Primary, secondary, tertiary, that may look different than when we cover infectious diseases. So we have to be able to apply it to different topics. Okay. So we covered a lot today. Has this been helpful?
Yes.
Yes.
Okay. So you should have your attestation done. You should have your quiz done. So the only thing left you have to do for this week is your do we have an NCLEX this week? No, it's next week. I think it's next week. So the only thing you have left to do for community is 2 peer responses. And you could potentially get that done now if you wanted to. I'll give you 15 minutes, gift of time. Get your 2 peer responses done now, and you're done with community for the weekend. Actually, you're done till you start studying next week. Okay. Make sure you've submitted your attestation. Make sure you've submitted your quiz. Okay. I'm trying to help you stay organized. I'm trying to help you stay focused and trying to get your stuff turned in so you don't have to keep thinking about community. So I know you get a heavy load with peds and med surg as well. Okay. So the next order of business is study guide. Now it'll be coming out this weekend. All right. And then next week, we are going to spend half the class going over content, and the other half of the class we're going to spend on the study guide. But I don't want you to wait till next Friday till you come to class to look at the study guide. It would, and because you're a Friday class, it would be helpful if you could review the study guide during the week, go through, kind of check off, yeah, we went through that, I know that. Oh, I have to go back and look that up. I need to read more about that or have a better understanding. Try and preview that study guide so that we can have a productive hour of review next week. Okay. And it's not just going over the study guide. It's what don't we understand in the study guide. Okay. Does everybody have their name in the chat?
Yes.
Okay. Okay. Questions? I hope this was helpful. I know we covered a lot. We are caught up at this point. And then next week we'll do, what are we doing next week? Next week we're doing the vulnerable populations. We're going to special vulnerable populations. Migrant, rural, homeless, and poverty. Okay. And oh, the other thing we're going to do next week is we're going to spend some time on that HESI prep assignment. So print that out between now and next week, because we're going to fill in what we've covered already after 3 weeks so that you're not stuck with a blank document in a couple of months. Okay. I don't mean stuck with it. I mean, you're not facing a blank document that would have been much more helpful to be filling out during the term. Okay. I hope you guys have a great weekend. Go do your 2 peer responses now and get it done, and you'll be good. If that's what you want to do. I hope everybody has a nice weekend. I'll stay on for any questions, and it was really good to see everybody today. Okay.
Thank you.
You're welcome. You're very welcome.
Thank you.
You're welcome.